During sleep, there is a natural physiologic loss of muscle tone that renders the human airway susceptible to collapse. It is generally believed that during sleep apnea, a number of factors contribute to airway collapse, including anatomical narrowing of the upper airway, a lack of rigid structural support for the human airway in particular, and a reduced muscular tonus associated primarily with aging. These factors all contribute to airway collapse, flow limitation, and sleep apnea. The pharyngeal training appliance, or PTA, was designed by Dr. Todd Morian to facilitate the proper exercise movements that are thought to help promote airway patency in sleep by improving strength of response to an airway challenge. The PTA is made to fit within the mouth like any traditional type of dental device. Minimal forces are exerted upon the teeth, which are only used to retain the device in place. The patented design uses a palatal flap to guide the first step in the three-part exercise sequence. As seen here, the frontal flap is pressed forward and upward until contact with the hard palate and front teeth is felt. Each press against the palate is held for 1 second. This exercise takes 2 minutes. The second exercise engages the back of the tongue and the remaining pharynx. With the tongue held in the forward position against the elastic resistance, the back or top portion of the tongue is raised to contact the raised target point located on the rear portion of the PTA. The tongue is held in position for a count of 1. When this portion of the exercise is done correctly, muscle contraction down the side of the throat of the patient is felt. This exercise takes 2 minutes. After the second exercise is completed, it is modified by holding the lips together and holding the target position with the back of the tongue while the cheeks are inflated. This is held for a count of 1 and then repeated for 1 minute. Finally, the device is removed for tongue brush stimulation. Using a standard soft toothbrush, the tongue is stimulated for 30 seconds on each side and top. This important component of the regimen is believed to bolster reflexive mechanisms controlling tongue positioning. Preliminary results have shown that the PTA device can improve sleep apnea in many patients. It is a unique self-help alternative to positive airway pressure devices, and when combined with other therapies like oral appliances for jaw repositioning or surgery, outcomes can be improved.